Leading us tonight in our first conversation about health is Shayne Silva. Shayne is a longtime advocate for children. She is currently the health advocate on the PTA legislation team, but has served in various capacities for the California State PTA over the years, including as director of legislation. She has also served 18 years on her local school board. In addition to her PTA work, she presently participates in the court-appointed special advocate program in Contra Costa County and looks forward to the time with her CASA child. Shayne has been a proud member of PTA for over 30 years and a former 32nd district president. She is married with 2 adult children. Shayne, I'm passing it over to you. The floor is yours.
Thank you, Mercedes, and thank you for inviting me to come back to my home area and meet with all of your panelists tonight. I'm really pleased to be here, and I'm pleased to introduce Dr. Patrick Joseph, who is, as you can see from the screen, the chair of the infection control at San Ramon Regional Medical Center. He's also an associate clinical professor of medicine at UCSF and a past president of the National Foundation of Infectious Diseases. We also have Dr. Jeanne Noble, who's the director of COVID response at UCSF Medical Center in the emergency department. She also is an associate professor at UCSF. And our third panelist is Wiseman. He is the co-founder of BeingWellCalifornia.org and a community advocate for mental health issues. That's close to my heart. I worked in patient psychiatry for 35 years. So thank you all panelists for coming and joining us. And thank you to the attendees. Our topic tonight is finding balance during the pandemic and beyond. And I would like to start with just having all of our panelists speak a few minutes about where they think we are today in terms of finding that balance. So Dr. Joseph, would you like to start off for us?
Oh, it would be a pleasure. And thank you very much, Shayne, for the lovely introduction. And thank you to all of the planners for this. Just listening to the time and energy that went into these sessions, I'm amazed. I do not want to cut into the time from the other panelists. They are the ones with the message for this audience. But I was asked to give a 2 or 3 minute overview of where we are and perhaps what's happened. And I want to tell you, I have decided during this, I am going to plagiarize your term resiliency, because the first thing that I wanted to say was just congratulations to all of us. And that means everybody listening and everybody who participated in this crazy changing time. And so I wrote this down. I just paraphrased it. Resiliency is the ability to tolerate disturbance without collapsing and rebuild when necessary. That is the best definition of the COVID pandemic in the United States that I have ever heard. So I'm going to take it from now on, and I'll send you royalties. The things that I want to say about this, and I'm going to give 2 examples that exemplify that resiliency. One is changing messages. It has been 15 months of changing messages. And that is perplexing to most people. But that's science. That's what we do. In fact, the more frequently we change the messaging, the better. When I was in training, we didn't change the management of simple pneumonia for years. It was the same year after year after year. But when we are changing messages, it's very simple. For something that's not understood, we get a consensus opinion and we invoke a practice. And then as we learn something, we change it. And that's what has been going on. And that's confusing to some people, but I think the more I talk to people, they understand that. So changing messaging is a good thing. It's progress. The other example of that is much more difficult to tolerate, and that is mixed messaging. That means on any given day, because we live in a free country, because we live in a free society, and because the internet is so widespread, one can hear 2 completely different recommendations from individuals who are apparently scholarly. And that's hard to digest. What is correct? What is totally off the wall? But we've gotten through it. And again, that's just an example of resiliency. The next thing I was asked to mention something is about vaccines and where we are. We just have to be proud of how quickly we have developed a vaccine, or many vaccines. We have 5 in the line right now. All are effective. All of them are far more effective than the flu vaccine, far more effective. And we've never had a vaccine other than perhaps hepatitis A that has been as good as the Pfizer and Moderna 2-dose vaccines. So we're looking really good at those vaccines. And we now have about 30% of the people in California and in the United States fully vaccinated and protected with a great deal of protective efficacy. So we're looking now for, and I'm going to use this term, this is not a molecular term, but this is a term I think most people understand, and that is resistant strains. We're looking very carefully at strains that might be resistant to the vaccines that we now have available. That's new for virus vaccines. We've never done that before. We never did it in the United States with a few exceptions, but United Kingdom did. And United Kingdom said, look, hey, we're finding some mutations that are stable mutations for which the vaccines may not work. So we have modified our entire scientific approach in the United States, not only in the state of California, a public health lab, but also the CDC labs where I'm involved. And we are looking very, very closely at mutations that may represent resistant strains. To date, none. The vaccines are not as effective against the 2-dose vaccines that we have in the United States, but the vaccines still work. So we're in a bit of this sweet spot, and we just have our fingers crossed that it's going to stay that way, but we're looking. And then the third thing I was asked to mention in my little brief overview here is what can we expect in the fall? And I'm going to defer most of that to others, but from a science perspective, I'll give you this. Within a couple of months, we will be vaccinating 12-year-olds. Looks very good. Advisory panel has already met. The FDA will expand the authorization to include 12-year-olds, but probably not less than 12-year-olds. In fact, we might not even see that by the fall when school opens. It's a much more difficult event to study because we do have to look more carefully at the kids developing anatomy and what the effects might be. So perhaps late fall, early 2022 at the latest. And what I can say as a substitute, and I'm not even sure we'll need this, but let me mention as my last comment, a substitute that will be available. Rapid testing will be inexpensive and readily available. So I'm not saying this will happen, but imagine it. Kids come to school, they line up, they get a swab that goes in an inch in their nose, it gets tested, in 15 minutes you have an answer, and they move on into school knowing that they are not infectious. That is a very definite possibility if we need it. So again, congratulations to everybody. It has been a wild ride for 15 months, not like any other infectious disease that I've lived through in decades. And I can only be proud of all of the science and, more importantly, proud of the American public for resiliency. So thank you again for the invitation. I'm really looking forward to see what the speakers have to say tonight.
Thank you, Dr. Joseph. Dr. Noble.
Thank you for having me. I'm, going to dwell on the optimistic tone there for a moment. We are in a great place now, finally, a year into this pandemic here in California. We have the lowest community rates of COVID in the nation. The vast majority of our most vulnerable are vaccinated. Most of our teachers are vaccinated, and our oldest students, at least, have already started the vaccination process. So we're in a very good and different place now than we were a year ago, March. So in March of 2020, why did we close our schools? We closed our schools because we thought that children would be the primary drivers of the COVID pandemic. We thought they would suffer serious illness and death. We thought schools would be super spreaders. We thought closing schools would save tens of thousands of lives. And now we know that we were wrong. Kids pretty rarely get COVID. It's not that they're immune, but their numbers are really small. To put that in perspective of, more than 80,000 deaths in California from COVID, there's only been 16 deaths among people under the age of 18 since COVID began, which is the same number of kids who die from the flu every year. So it has not been, it didn't turn out to be an influenza-like disease. And in fact, it's important to recognize that mental health issues have always been a really important consideration for kids who are transitioning to different periods in their life, primarily the time of adolescence. So adolescents are about 14 times more likely to die of suicide than they are of COVID. And we have seen a real mental health crisis among our kids during the COVID pandemic. So in the emergency department in Children's Hospital of Oakland, we have seen a 66% increase in the number of kids coming in ages 10 to 17 with suicidal ideation, meaning they have recent or active thoughts of wanting to end their lives. We've seen about 130% increase in the number of kids who have been required hospitalization for eating disorders, and about a 75% increase in the number of kids brought in for mental health services who required immediate hospitalization. And those numbers are comparing 2019 to 2020. So kids have not weathered COVID particularly well, even though they haven't suffered a lot of physical illness from COVID infection per se. But continuing on the theme of resilience, so not to dwell on really sort of depressing statistics, but thinking, how do we move forward from this? Moving forward with resiliency and building resiliency in our kids does start first with recognition. So it's important to recognize that kids have been asked to sacrifice a lot in this very unusual time. As I referenced, when we first closed our schools, we thought that we would be really doing it to stem the spread of COVID. And then it turns out that kids are much less susceptible to COVID than adults. Yet their quarantine, their isolation has been longer than it has been for adults at all. So really recognizing what they've been through and even expecting that there might be, some resentment there, and showing appreciation and recognition that we know that they've struggled. And then reassurance that things are going to be okay. They are actually already on the road to getting much better, which is tremendous. Children tend to live much more in the moment than we do as adults. And it can feel like, I hear this all the time from kids who come into the emergency department that, they don't believe that things are ever going to get better because they've already forgotten how normal life is because it seems so long to them. And to remember that and to really realize that kids do need a lot of reassurance that things are and will continue to get better, particularly by the fall. And then encouraging kids to really get out of the house and to socialize is incredibly important. And again, particularly adolescents, the mental health toll that we've seen is really for our middle schoolers and our high schoolers, which makes sense developmentally because younger children, although, Zoom education has been much harder for them to, I think, absorb and navigate, they're still primarily attached to their parents for approval and not seeking independence as much as middle schoolers and high schoolers are, who are really primed developmentally to be making those connections outside the home. So it's that age group where we've seen the greatest harm. And so putting aside to as much as we can the almost adult phobias we have of the realization of all of the illness from COVID, realizing that our numbers now are incredibly low and really showing a lot of confidence and reassurance that your kids can and should be getting out of the house. If their schools are open, reconnecting with their peers, reconnecting with their teachers, their coaches, their counselors. And then finally having a really low threshold to seek mental health services if it seems at all needed, and being in really great touch with teachers. It's, you know, it's been a time of pretty severe social isolation for a lot of kids. And the quickest road to recovery is really putting them in touch with the support system that they need, those other trusted adults, getting them back out into a normal routine, exercising, socializing. That is exactly what they need. And they've sacrificed a lot. So building resiliency, I think those are the steps to get there. And it's great to be having this talk now when there's so much to look forward to, as opposed to back in December during the dark days of our search.
Dr. Noble, before we go to Graham Wiseman, can you repeat, there was a question that they missed when the time frame for the 12 to 16-year-olds to might be able to get the vaccine. Could you?
Oh yeah, so the
Dr. Joseph, either of you.
The 12 to 16-year-olds, we are expecting that approval basically any day. So 12 to 15, the 16 and up are approved for the Pfizer. So that the submission was made on April 8th or April 9th, I believe. And we fully expect that the Pfizer vaccine will get the EUA, the emergency use authorization. And we expect it really any day in May. You know, we think that will start happening soon. And then, as was mentioned, are under age 12, probably not until, you know, December or so. They aren't even, you know, fully finished enrolling in those trials.
Right. Well, Graham Wiseman, I suspect that you have something to say about where kids are mentally and emotionally right now. Would you like to go ahead and give us your feedback on that?
Yes, thank you. And I would really like to thank Dr. Joseph and Dr. Noble for really going over some of the facts and figures that are out there, and also giving that word of encouragement, because that's what we've been missing for so long, is really words of encouragement. You know, our entire country, all of us as a community have gone through a traumatic event, and we're still, you know, trying to emerge from it and figure out what's going on. And when I look at other traumatic events in history, like the bubonic plague that killed half the people in my home country, you know, it's like, what happened to culture, society? How did the people emerge from that? And the answer is that they tried to get back to what was normal as quickly as they could. The effect on society was dealing with what you've experienced and moving on. The trouble is, young people don't have that perspective. They only have their short time span and what they've seen. And unfortunately, they pick this up and they look at their social trauma, which is what I call social media, because it can really affect the child. And they really don't have the filters that are going on. So as we think of school age kids, you know, there's elementary, middle, and high school. Last week, I spoke at a middle school in Livermore, and I talked about, you know, risky decisions that come up. And one of the things we talk about is mental health. At the end, we give a survey. So I spoke on a Tuesday, the team spoke on Thursday. So 2 days later, when we asked these students, what kind of stuck with you? A lot of them talked about the mental health component that they had heard on Tuesday. And 25% of these youth said, I've thought about suicide in the last 10 to 12 months. So I'm going to let that sink in. These are middle school that's looking out at a basketball team and knowing two of the kids on, you know, those teams are thinking about suicide. It is really, really a scary number. And I know this because I talk to students, I talk to parents, and I talk to many parents just after they've lost a child to suicide. And the reason I'm talking to those parents is I'm one of those parents. We lost our child, Colin, who was a 15-year-old sophomore at Akalani's high school. We thought we were doing everything we could to help him with his depression, and it beat him. But buried 60 feet from Colin is another boy from Akalani's, Jake. Jake's parents had no idea he was struggling with any mental health issues. In fact, they called him on the phone and he had just moved off to college. How are you doing? He said, I'm fine. He'd already put a letter in the mailbox, letting him know what he was going to do. And he did that the next morning. So I mention that because there is no easy answer. There is no, if they do this, then that. It is, each child is unique. Each person is unique. And when they struggle with these mental health issues, they're all going to kind of present in a different way. One of the things that's common is sleep. So when we think about our kids, when we think about what's going on with COVID, the trauma, getting back into school, all the things that as adults that we look at, one thing that's really important is we look at how much our kids are sleeping. So if they're only sleeping 5 or 6 hours a night, that's a warning sign. If they're sleeping 12 hours a day, that's a warning sign. If it continues for 2 weeks or longer, then you need professional help. And that's just kind of a guideline I give to all parents. But as we look at COVID and what's happened to us as a community, what we find is one of the greatest tragedies is our loss of trust. We don't trust the media. We don't trust doctors. We don't trust politicians. We don't trust teachers. And we don't even trust our parents sometimes because of what's been going on for the past year or actually longer. So how can we help our kids get back? Well, what we need to do is really start working on building that trusted space, making school a place that they can trust when they go there, that they're not going to be manipulated or not given the full story. The kids really want to know what's going on. So finding that trusted space can be difficult. And I know with individuals who are struggling, a trusted adult is really critical for them. There's programs out there. There's one currently the California Department of Education is supporting, actually called a Trusted Space. And it's a program that helps teachers create that in a classroom in a 5-day period, trying to get kids to feel safe again. And that's really something that we're gonna have to work hard on, all of us, to get people to feel safe, safe to say hello, safe to touch, safe to be within 10 feet of them, right? There is something came out of University of Colorado in the late 70s called Who You Are is Where You Were When. And what it does is it says that what's going on in your life when you're 10 years old will have long-term effects on how you view things. So if we use me as an example, when I was 10 years old, we had the Arab oil embargo. So a commodity like gasoline was not available. There was a little thing called Watergate that was going on. So what that did is that affected how I view politicians and government. United States was just withdrawing from Vietnam. So that questioned, what do we do? But it wasn't all bad. We also kind of got sick and tired of breathing beige air. So we founded the EPA, right? We started helping. So what we need to do as adults, what we need to do as parents is really focus on what we can set for our kids so that when they're 30 years old, they'll be comfortable talking with strangers. They'll be comfortable being near people. And we don't want that, what happens to them when they're 10, to be a detriment in their life.
So true. Thank you. I'm wondering if there are health issues, other kinds of health issues that have come up for kids since COVID that you have noticed happening.
So the most prominent one is just related to decreased physical activity. So we've seen spikes in obesity, actually fatty liver, which goes along with obesity, but definitely an uptick in that, and pre-diabetes and even diagnoses of diabetes. So the physical has been related primarily to lack of activity. Kids have become way more sedentary, which is not going to be a surprise to any of the parents during COVID, which is really not biologically natural at all. I mean, kids should be running around, and they have been seated like middle-aged adults. And then, in addition to the depression and suicidal ideation, we have seen a lot of social phobias really crop up, a lot of, severe anxiety as well, and fear of leaving the house, which increases the sort of sedentary nature that that not being in regular school has promoted.
it seems one of the things that we're seeing happen here is a greater awareness of how the physical and the mental issues are so intertwined. And I think that's one, I hesitate to call COVID having a silver lining, but I think it's made us more aware of the fact that these things are so very intertwined. And we talked a little bit about social interactions and the need to get back to that. Do you see that as being an ongoing kind of a problem for kids?
Yeah, I mean, I think that, weathering the pandemic was probably easier. I share Mr. Wiseman's feelings about social media causing a lot of harm to children. But it was, I think during this year of really pretty severe isolation, at least a little bit of a bridge to socialize with others, but not a substitute for real human interaction. And, and the hours are still greatly reduced too. So social interaction has been reduced qualitatively and quantitatively. And I think that, as schools reopen and kids are back out there in the public sphere and participating in sports, et cetera, a lot of this will, happen naturally with time, but really important to be on the lookout. I think that, the adults outside of the household and even within the household have a big role in making kids feel like it's okay to socialize, and not instilling fear that it is, this is dangerous, back up, don't get close to your friends. And, this fear of human interaction is real. I mean, we see that definitely among adults, and kids model a lot of what adults do. So I think having a real eye out to, inclusion, warmth, toning down, it's really time to tone down the fear. Even about physical distancing, our rates of COVID are incredibly low. Kids do not really need to back up from one another. So just shepherding them through that process.
And maybe Dr. Joseph, this might be a question more for you, but feel free anyone to jump in. Are we concerned about any variants that might be stronger or more hazardous in terms of COVID and infections?
Yeah, let me give a quick answer, and I don't want to, I mean, I'm just enjoying listening to Dr. Noble and Ms. Wiseman. So let me give you just a quick scientific answer. Yes, of course. We have an extremely sophisticated way of looking for mutations in virus. We just never planned on invoking it for so many COVID specimens. My labs are doing it and other laboratories are doing it. And we are looking for mutations that persist, and we know where to look for them. So looking for the mutations that are likely to do one of two things: either evade the effectiveness of the vaccine, comes up from a particular area of a gene, and mutations that are likely to be more contagious come from a different area of the spike gene. But we have no knowledge and no way to predict whether they will be more severe or less severe. A quick answer: this is learning in progress, but we have the methodology to look and follow.
Okay, great. Good to hear that. I'm wondering, when we talk about the things to look for in children in terms of their mental health, particularly in middle school and high school, Graham Wiseman, I believe that you were instrumental in setting something up at your son's high school. I wonder if you could talk about that a bit and how we might be able to use that in a broader sense.
Sure. After losing Colin, I was contacted by two other parents from the high school. I went to that high school. My wife went to the neighboring high school, so we definitely had a connection in the community. These two parents, one had a child with severe anxiety. She'd been out of school for 6 months. And the other had a child with leukemia. And so she'd been down at Children's Hospital in Oakland through most of her middle school time. So these two parents obviously had their, fair share of interactions with school districts. We got together, we had a list of things we didn't like that was going on, and we came out from that and said, well, what are things we can actually positively impact? So we looked around at other schools that shared similar demographics. And, we went to Piedmont, we were in Marin County, we're down on the peninsula. If you live in this area, you're starting to pick up a theme here of the school districts that had one thing in common. They all had wellness centers. So we looked at what a wellness center actually was, because it's a very vague term. It could mean in San Francisco, it's a place to get your dental care, birth control. There's a lot of other stuff goes on in a wellness center, but we were focused on mental health. It took us 5 years, but we got the Alcalanes Union High School District to fund on-campus wellness centers staffed with school district personnel and change their reentry program for when kids were out of school. In our district, 68% of the kids on home and hospital were there for anxiety. And the way that they were brought back into school was on Friday, you're in home and hospital, and Monday, you're back in school. And they went right back out, went right back out. So we were really pleased with that. And then that, of course, got the attention of San Ramon. So we started working with them for a couple of years. And we actually had a site visit. We brought the wellness team from San Ramon up to Alcalanes High School. And at the end of that meeting, they said, we don't need to see anything else. We know exactly what we want, and we're going to put this in. So one of the things is, these wellness centers are effective. There's a lot of research on it. And I was really just so impressed that San Ramon said, we're going to put them on all campuses, K through 12. So we got the first two went in at Cal High and at Doherty, but then of course COVID happened. So everything's kind of stopped. But, people say, hey, that's great, Graham, but who can pay for these? So that led to us working on a campaign, which I believe you're familiar with, and is supported by California PTA to fund these wellness centers. And people say, well, Graham, why are you so fixated on wellness centers? A study came out of the University of Michigan in February of 2019. It was a 12-year study, and they took students who had either made suicide attempts or showed strong suicide ideation. One half of the group got the standard treatment. The other half of the group got the standard treatment, but with one difference. The youth selected a caring adult. That was the only difference. At the end of the 12-year study, the death rate was 660% lower in the group that had a trusted adult. We find those trusted adults at wellness centers. That's why I'm really pushing that we need these on campus. We need to build that trust back up. And imagine if we can reduce our death rate. I went on vacation in January. I came back and my phone was just on fire. We had 5 student deaths in Contra Costa and Solano County within a 1-week period, all suicides. At the death rate for COVID at that time in California for people under 18 was 0. So the mental health was what was killing them. And so people got very emotional and upset, but that wasn't the right direction to go in. The right direction is to look at what's going on and offer support. So, those wellness centers, it was just 3 adults, just 3 parents, and we got that district to commit to $1 million to provide help for our kids. So this is the PTA, right? These are the people who can make this difference. And I hope I'm preaching to the choir here.
Actually, you're leading into my next question, which was going to be, yes, this is the advocacy conference. What kind of advocacy should the folks tuned in here engage in? I know from work that I've been doing in Sacramento, mental health has become there's 35 bills, I believe, right now that have to do with mental health in one form or another. I'm actually following 7 right now that we've taken support positions on, including your bill, SB 21. What kind of advocacy should parents be doing in order to help their children get through all of this? And that's a question for all of you. It's not, I think you all have different perspectives on that. So go for it.
Okay. So Senate Bill 21 is the mental health awareness license plate. So that is we ran a statewide competition. It was won by a student from Doherty Valley. So she's a senior there now, Anushri Banerjee, and it's a wonderful, wonderful design. If you go look at our website, you'll see it's beautiful. That license plate raises funds to go to the Department of Education. So we've had the pleasure of speaking one-on-one with Tony Thurman, who's our state superintendent. And he's like, yeah, we need these wellness centers in here. We need funding. And he's like, I am your champion. I'm not even gonna have staff go and testify. I will. So he's really got a firm belief in improving it. There's actually 1,000 bills this year that have mental health somewhere in their language. So I do not envy you for trying to sort through them all, right? But for parents, hey, go to our, I'll just shamelessly plug it. Go to our website, beingwellca.org. You can see the license plate. You can sign up to support it. If we get 7,500 people to say, yeah, I'd like to get one, you don't have to pay anything. Then the governor is not going to be able to say, we don't want this. It'll really make a difference. Advocating going to a school district with a solution and not just to complain about a problem is really how we can advocate and make positive change in our students' lives.
And I would just add on, sort of the personal advocacy rather than the state level, which is so important and encouraging to hear about Tony Thurman's support there, is, what we can all do as parents and interfacing with our schools is really encourage kids to get, if they have the option, if their school is open and their class is open, to really take that step and really try to get them to go back to in-person schooling. And the more kids who do this, the more they're going to want to. I mean, there's been a lot of complaints of, only some kids come back. It's not their friends. It's awkward. It's strange. They're nervous. And then they say, forget it. We're just going to do Zoom. Realizing that is not a healthy option for kids. And just, we got to help them through this transition. And once kids are back, more kids come back. And that's a daily benefit for kids' mental health that we really need to promote now. And the more we can get sort of that path well grooved between now and the end of the school year, the better. And not really waiting till fall.
I think what you're saying is so true. I mean, I've heard stories about teenagers who over this past year, suddenly they have acne and they think they're the only person in the world that has acne. And they don't want to go to school because they have pimples all over their face, and they get to school and, oh, wait, everybody else has acne now too. Look what happened. And so I do see your point that kids can really distort things, and particularly adolescents go through so many physical changes during adolescence. And if they're not around their peers to see that everyone else is doing it, it can become very, very difficult for them to get back out there. So I'm wondering if any of you would like to predict what classrooms are going to look like in the fall when kids hopefully will be back in school in a more traditional way, I guess is the best way to put it.
I'll just jump in with what I have heard coming down the pike from California Department of Public Health, that there will be no social distancing rules at all. And, as we know, we had a 6 foot or an absolute 4 foot mandated rule that then got dropped from a mandate to a 3 foot recommendation, but no social distancing recommendations at all, which will be really nice. We will have, we've been, as adults and teachers, most worried about our middle school and our high school kids. The majority of them hopefully will actually be vaccinated over the summer. So you have vaccinated teachers and vaccinated students. There's really no reason that middle school and high school shouldn't look much more like pre-COVID times than they have during COVID times. And then we know that elementary school kids have never, we know now that they're really not much of a risk. So I think school, hopefully, fingers crossed, is going to get off on the right foot, on time, full 5 days a week, and will really feel like normal school. And then the one issue, social distancing gone, there's not going to be any recommendations for these deep cleans, et cetera. We thought early on that COVID was, probably a fomite disease, could be spread from surfaces, and that sort of never really panned out. So, no Wednesday close downs for deep cleans, no social distancing or physical distancing. And then when do we get rid of our masks? And that's kind of $1 million question. And I don't know. I don't know. Maybe Dr. Joseph will look in his crystal ball there. I have a lot of people saying by Thanksgiving, and maybe California, it's going to be earlier than that. Not sure.
Dr. Joseph, you're on.
I don't like to predict things. Let me give you the facts. The advisory committee, which is a different committee for immunization, but an advisory committee of the CDC came up with the guidelines to Dr. Walensky that were released last week or earlier this week about masking when it's not necessary. But here's the structure that many don't understand. The Centers for Disease Control and Prevention makes only recommendations. They have no legal authority whatsoever. They make recommendations based on consensus opinions of very, very brilliant people, and hence the recommendations of demasking. So if one is fully vaccinated, there's now very few places that a mask is even recommended. And that would be a large social event, a big crowd gathering, a concert, a sporting event. But in the United States, we have 64 state, tribal, and territorial governments, each of which has the authority to determine what guidelines to be used or followed. So California is one of those state governments. The recommendations are very clear, but it will be up to the current governor and all of the public health advisors to determine which, if any, of those guidelines will be followed. If we do not see resistance occur, then we will be demasking in a regular rate.
Okay. So I'm wondering, we've touched on this a little bit, but I'm wondering if you see any long-term social changes going on, particularly for kids because of COVID, as a result of COVID.
I'll just say on the resiliency theme, I don't think long-term social behaviors are really going to have changed. I think the question of how long it will take us and our children to fully recover, but I do think that they will go back to, really normal, robust, warm interactions with one another. And the question really to me is how quickly we can sort of normalize and get them there. And that maybe a silver lining here is, mental health issues for kids have been a neglected issue for a long time. I mean, in 2017 or 2018, I think there were 275 adolescent deaths by suicide in California, which is, when you talk about 16 deaths from influenza or COVID and 270 from suicide, that's a big deal. It's a major cause of death of kids. So taking this, we've seen a worsening of a crisis, but a crisis that already existed. So I do hope that we have raised awareness and that we don't just, shove that issue back under the rug as we normalize our social interactions and do more, like the wellness centers and the legislation to really make our kids healthier and even, better than before.
So I do have a question here from the audience. Dr. Noble, it's great that kids aren't dying from COVID and that they will be able to be vaccinated, but what about long-term side effects from COVID?
Yeah, so we're studying, we have a study at UCSF right now about, this colloquial referred to as long hauler syndrome. The initial data I think actually looks pretty optimistic. So some of the studies on the long hauler phenomenon of people having, persistent symptoms well after they've cleared the virus from their bodies have had some methodological problems. The two largest studies, actually half of the people approximately in each of those studies never had a positive COVID test and don't have antibodies. So it's a little bit questionable how prevalent this phenomenon is, which is, this is kind of normal in the ebb and flow of science. I mean, we see things happen, and we want to investigate. I think that the number of kids affected by any kind of long hauler syndrome from COVID is incredibly small. So quantitatively, it's not a significant pediatric health risk. Fortunately, kids have just been very resilient when it comes to COVID, less likely to get infected, much less likely to get sick, and small numbers in terms of any longer lasting effects. And of the effects that we've seen, they seem to, dissipate with time. This is a new illness. We, of course, don't know the final trajectory, but a lot of viruses have caused, sequelae problems after the virus is cleared from the body, that don't lead to lifelong issues. So I think good reason to be optimistic there.
Well, glad to hear it. Dr. Joseph, did you want to add anything to that?
No, that was, I think the question for tonight's audience is children, kids, pediatrics, and not my expertise. Adults clearly get more severely ill. They have a different illness. Long haulers is a real deal. But if we're talking about the long-term effects of a virus, we're also talking about a virus that's only been prevalent for about a year. So it's a little early to reach anything solid. Definitely, I have many patients who have unexplained symptoms that persist for 3 to 6 months. But it's too early to say if that's just going to go away in time. I will tell you scientifically, the cause for the persistent symptoms is unidentified, but certainly being investigated. So stay tuned.
Well, since we're talking about and beyond here, I was wondering, do we need to prepare for another pandemic? And do we have the tools? Do we need to be concerned about that and do something different, or how would we prepare for that if you believe that that's coming?
Well, if it's to me, it's a quick answer. Absolutely. We were unprepared. We need to be prepared. And so that's a simple answer. It's easy. The difficulty is what is preparation and what is satisfactory preparation. And that's very hard because the next pandemic may not be a respiratory infection. It's unpredictable. A pandemic by definition is a worldwide epidemic. So I think what we have learned is the preparation needs to be flexible. It's not, let's stockpile personal protective equipment because the next pandemic may not even be infectious. But let's be flexible as much as we can so that we can move quickly. So I do believe, yes, we do need to be prepared. And I think all of us who are listening tonight, the entire audience, should rest assured that this is not going without notice. It has both local, national, and international political attention that we don't want this to happen again.
Good to know. Good to know. It seems to me that one of the takeaways from this evening is that we really need to be paying attention to children's mental health, that we need to be aware of our kids and how they're feeling and noticing changes in their behavior. Anything else in that regard that we haven't talked about that you think it's important for our audience to know?
I think that, what we're dealing with on so much of this is perception. In my school district, 70% of the parents wanted their kids back at school. I know at Doherty, 17% wanted their. We're in the same community, we're the same kids, it's the same virus. So why is one community say 70%? Yeah, well, let's get back in school, and the other 17. It's a perception issue. So we really need to step right in front of that and help people understand. And I think Dr. Noble has really been extremely forceful on just giving, this is science, these are facts, and we need to remove opinion from it and move to what is really happening. I did see a comment in the chat regarding wellness centers, and that's a perception issue also. If you believe that somebody saying I need a break is an excuse, then you're really not addressing why somebody would say I need a break. As a child, stepping up and out of a class is a traumatic event because everybody's going to judge you. What's wrong with you? Where are you going? And so forth. So for a kid to have that inner strength to stand up and say, I'm going to go take a break, really is a great thing for them. The perception, though, of just a place to hide out and get some tea is it actually belongs in the 50s, quite honestly. We've evolved at school. Students come in, they're scanned. The professionals there know if they're a frequent flyer. They know if they're trying to get out of a math test. All these things are done to help get our kids back in. So we need them back in class. We need them back. Actually, I want to see a better normal. I don't want to go back to where we were because you know what? In San Ramon, I looked it up just before this. In San Ramon, the suicide ideation in the junior class was 22%. In the non-traditional school, those are the kids that are off on the other school, it's 40%. That is a breathtaking amount. And I go back to these numbers because the perception is it's not going to happen to me. Well, guess what? It happened to me. I thought I was doing everything possible. And unfortunately, I now know a whole secret club of parents, a club nobody ever wants to be in, that have lost their children to suicide. And we don't wear medals. You know why our soldiers wear medals on the left side? That's to warn death that they're about to face a warrior. Our kids that aren't ready for that, right? When death comes, they're not ready. So we really need to take a step back about our perceptions about what it's like to be a kid, because being in school is nothing like it was when we were in school. And you throw a pandemic on top of that, you throw social unrest on top of that, you throw a political climate we're living in on top of that, and these poor kids, they really need our help. And it's up to us to help them, because like a table that's unstable, it can't fix itself. It needs one of us to kick a wedge under that leg and give them a stable platform to build their lives upon. So that's my ask, is that we take a look at our perceptions and check them and make sure that we're actually thinking of our kids.
All right. Anything else? Any last words?
I just want to second that. That's really beautifully stated. And I think that, anytime we've been through a big traumatic event like COVID, it's looking for ways to come out better and stronger and not going back to the same old normal. And we have, COVID policies, this is not to undercut all of the astounding numbers of death and suffering associated with COVID disease. But at the same time, our COVID policies often have really hard ramifications. I mean, we've seen, skyrocketing rates of death from opioids and homelessness and all these things. And, people can't be with their loved ones inside the hospital. There's all sorts of downstream consequences from our attempts to do good, which are often entirely necessary. But in the spirit of we can always do better, learning from what we've, done over this past year. And hopefully, if another pandemic like this hits us in our lifetimes, we will do it better next time.
Thank you all very much for being here this evening, spending time with us. I really appreciate it. I hope that our audience enjoyed it very much. I found it very informative, and I want to thank you all.
I would like to thank you, Shayne, just for giving me the opportunity to sit in and to listen to the brilliance firsthand. Dr. Noble and Mr. Wiseman, I've learned so much, and I just appreciate the time, the energy that both of you have put into our kids, to understanding it, and then what we're doing tonight, and that is teaching. So it's been my honor to sit through this. Thank you very much for the invitation.
Thank
so
you
much.
to all of you for joining us. Thank you, Shayne, for leading our discussion. That was reassuring and enlightening, eye-opening. Thank you for your knowledge and thank you for sharing your time with us. As parents, we really needed to hear that conversation and you complimented each other so well.
All right.
All right, we're going to move on to our next panel. Thank you again.
Thank you.
Thank you.